several diseases which cause the cornea, the front part of the eye, which is the window to the eye, to become cloudy and thickened. One of these is the Fuchs corneal dystrophy. You can see a cloudiness, haziness in the cornea, and accordingly the patients have poor vision. This may also happen after cataract surgery at patients who were already at risk. The treatment for such a haziness and cloudiness of the cornea until now was what we called a corneal transplantation, where we transplanted the cornea of a donor and had to make sutures to actually stabilize the cornea. Patients often still had poor vision. There is a new technique since a few years which is called DSAEK, where we actually only transplant the innermost layer of the cornea. Here you can see that we're actually transplanting a small layer of cornea. This was a layer which was actually the cause of problems. And then over time, after a few weeks, the cornea becomes transparent and much thinner. So here you can see such a donor button which doesn't have any stitches or sutures, but is just held onto the cornea in the first few days with an air bubble and then actually sticks to it by itself. And accordingly, the very clear and transparent cornea, and here you can see the thin transplant. This new technique of surgery, of transplanting only the innermost layer, has resulted in much better outcomes for patients, and especially the patients are rehabilitated much more quickly after surgery.